for having me. This was fun.
I'm so happy. I feel like we learned. How many people feel like we just went to school? Or just
wasn't too proper.
Fun, you know, the fun lectures. You know the teachers that you want to go and sit down with, not the ones that are, this one. Yes, so we're going to be speaking about, of course, anxiety and panic attacks today. Now, I want to know, and I want you to tell us, of course, how you overcame this. Sure. But one thing I want to kind of put out there and ask if this sounds quite right is, before a panic attack, I believe you have to be anxious or feel anxious. Mm-hmm. So I believe that anxiety can lead to a panic attack. Is that correct?
That's correct.
Okay, cool. Yeah. So what was, I guess, what made you anxious?
Okay.
And then how did the panic attack come about? Because some of us could be anxious, but maybe not have a panic attack. Right. Some of us could be anxious and then have a panic attack. So how did it start?
Okay. You know? Well, no, that's a great question. So with anxiety, you know, I think when I think about the body and the human body, I always just thank God, because we are really fearfully and wonderfully made. And He created us. We have a certain level of anxiety is normal, right? So if you get a new job or you're going to do a presentation and you get a little anxious, that's normal. And if I can just spend maybe 2 minutes, just kind of, I don't want to get deep on like anatomy, but the way that, you know, our body is created, our central nervous system controls and coordinate every function of our body. And when we are anxious, our brain releases chemicals that goes to our adrenal gland, and it pretty much prepares us for fight or flight. We've heard the sympathetic nervous system prepares your body to either fight or run, right? And so a part of that system, it increases your heart rate, it gets your breathing elevated, and just a lot of things happen. But normally, after that happens, your body kind of relaxes and the hormone levels goes back to regular. So when you have anxiety, for me, you know, I feel that increased heart rate. Usually the things, and it happened for me very subtle. Like there wasn't different people, anxiety is triggered for different people by different things. Sometimes it's a traumatic event, sometimes it's you know, a memory of something. And for a lot of people, it's just a buildup of stress. And that's what it was. In a short period of time, I went through, over about a 3-year period, I went through a whole lot of stress. And me being the, you know, the doctor, the wife, the mom, the sister, you know, I just kind of pushed through. And, you know, I lost my mom. That was a really trying experience. And within 2 years, I lost both parents. I relocated, I opened a new business, and I was just pushing.
A lot going on,
A lot going on. And there were signs, but, you know, you kind of just push it down because you got stuff to do, right?
Yeah.
And I remember the first time, my first memory of something being kind of off, I was at a health fair. And usually, you know, I'm there, I have my assistant, we're giving out health information. I decided to walk around, and I saw there was this booth that had a paramedic, and he had, you know, the rescue breathing, the mannequin. And I remember seeing a tiny rescue apparatus. And immediately, like simultaneously, my mind saw my baby with the apparatus on their face. And I felt just like an electric sensation went through my body, and my heart rate elevated. And I walked away because I was like, well, how did that happen? You know, I wasn't consciously seeing my child needing a rescue equipment, but that's how anxiety works. It kind of just, your mind kind of just puts you in a worst case scenario.
Wow.
And that's what started happening. And every time it happened, I noticed my breathing elevated. I noticed, and so I never had a chance to relax. I was constantly in that heightened sense of fight or flight, and so I want to say the difference between anxiety and panic is anxiety, there's usually a trigger. You have, something that triggers that anxious feeling. With panic attacks, usually, I mean, for me, there was no trigger. I would be happy, not thinking about anything, and out of the blue, I start having like really fearful, feelings, and it just escalated from there. So for me, it was a subtle onset.
Yeah. Because one thing that stood out to me when you were speaking is, when it comes to the anxiety, it's almost like you look at that situation in the worst case scenario. And yeah, so even before you have, like, for example, you could be anxious about, I don't know, an interview, a new job. Yeah. It's normal to feel what am I gonna, what's gonna happen? And I guess being a student, even exams, things like that, But when we start to think, I guess, of the worst case scenario, I feel like then we start to imagine us not fitting into that group, you know what I mean? Or not passing that exam, or not being good at that, that new job, or whatever it is. So yeah, and of course, when it comes to anxiety, I believe that even in the Bible, Jesus was saying that be anxious for nothing. And I believe there was a reason why he said that, because he knows that this is something that we're going to face in this world. Do you understand? So it's almost like, be anxious for nothing, put all your trust in me, and I'm going to lead you. However, we definitely all have those times in our life where we're thinking, oh my gosh, I remember my friend, one time she was telling me that she used to be anxious to go to school. She would not sleep. She would just watch the clock, like tick. She'll wait for 7 because she's just so anxious. Do you understand?
Right.
Yeah. So when I mean, I know you told us that you was at your the first time you had the panic attack was when you were at that
that wasn't a full-blown panic attack. That was just my first feeling of recognizing that feeling of anxiety. Right.
Oh, right.
So, just over like the next few years. And I think what happens, and I talk about silent sufferers, because there's a lot of people that are dealing with anxiety, but they don't know how to name it. They don't realize that is what's happening to them. So there will be several triggers over. I mentioned I'm a healthcare professional. There'll be times I'm talking to a patient, and I know a lot of my patients dealt with anxiety, and they'll be explaining something like they're having, increased heart rate, and something in their conversation would trigger my own anxiety.
Oh, and okay. Wait. So when you're basically sitting there having a discussion with them, and you're doing a consultation, they may say something, and you're thinking, whoa. So how do you deal with that?
So, in the moment, you try to do everything you can to remain calm. And one of my big things before I actively started to try to manage it was I would breathe and I would talk to myself, right? I would quote scriptures, and I would do affirmation. And for a minute there, in the midst of talking to a patient, my head is going, but my mind is like trying to calm myself down. Eventually I get to a point where I have to excuse myself. And I've done it on a couple of occasions where I ran out of the room and like went outside, got some fresh air, took a few deep breaths. Just God hasn't given me a spirit of fear, and just kind of do these recite scriptures. And once I was calm again, I returned like nothing happened, and just kind of continued, and that was okay for a little bit. But different things, like I would feel anxious on the road. You get in traffic, and that thought process you see maybe a close call, or your mind just start imagining, what if that car moves over on you and you see yourself in an accident? And, I start to just, every normal thing that happens in life, my mind was telling me that, like I said, it was imagining that worst case scenario.
Yeah.
And I still run early in the morning with one of my friends, and I was having like difficulty breathing. And so I decided, all right, let me go to a doctor, because but I thought I was having heart issues. My heart is racing. I'm having breathing issues. And I went to my primary, just, having a conversation, kind of make sure my heart is okay. And we went through the entire heart stress test and and my heart was perfectly fine. We did EKG and all of these things, and my heart was fine. He gave me a prescription for Xanax. And I know that Xanax is a anti-anxiety medication. And it kind of confirmed what I thought maybe. We never discussed anxiety in my meeting with the doctor, but he said, just here's a prescription for Xanax. Just, take a half a pill and take the edge off. And,
what did you feel? No, what was you thinking? Why are you prescribing me this? How did you feel about that?
Well, I thought, because we didn't have the conversation about anxiety, he was just testing my heart. And I think sometimes as a physician, sometimes we go in, once physicians know that you're a physician, they don't go through the whole thing. They treat you a little bit differently because they expect a level of knowledge on your part. So, we didn't go through the entire conversation. He checked my heart. My heart was good. I was referred to a cardiologist. My heart was good. And with this prescription, I didn't say anything to him, but for me, it kind of confirmed that, okay, maybe he thinks I'm anxious as well. So let me do more research into how I can manage the anxiety.
Right. I'm just curious, because I know you were saying a few seconds ago that when you would sit down with some of your, your patients, you'll be talking to them and something could trigger, or bring on a feeling of anxiety. I'm curious to know, what would it be? Would it be a specific phrase, or would it be a sentence that would trigger? What would that sentence sound like? I'm just quite curious. Yeah.
Sure. So I remember one specific time that I had a huge anxious feeling. Was I was talking to a patient, and she was saying that she thinks she is dealing with anxiety because when she's so afraid to drive on the highway. So she lived a little bit away from the office, and it would have been an easy 10-minute drive, but she would take the back road. And even taking the back road, she said she felt like, she gets so nervous and her heart starts to race, and she's describing symptoms that I'm normally having. And as she's describing her symptoms, I'm feeling them, so for that particular time, any little thing that I dealt with and I hear it with someone else, it triggered something for me.
Yeah.
So, or someone talking about their child is ill, or their mom died, or, anything like just the smallest things that doesn't normally bother someone triggered a anxiety attack for me.
Right. That's I can totally understand that. Sometimes I feel like when we are, when we've passed through an experience, our discussions with another person can sometimes bring back those same feelings.
Right.
And it can be uncomfortable. So like you said, you would step out usually of the conversation. And you said that you'll speak to yourself. You will quote scriptures. What were the scriptures you were quoting? What were some of your favorite ones that is like your go-to scriptures whenever you had that feeling?
Sure.